Violence.
Risk for violence directed to self and other. Contents. Definition of violence. Typology of violence. The nature of violent acts. How can violence be prevented? Case scenario. Approaches. WHO defining violence as the intentional use of physical force or power, threatened or actual, against oneself, another person, or against a group or community, that either results in or has a high likelihood of resulting in injury, death, psychological harm, maldevelopment or deprivation. Typology of violence. In its 1996 resolution WHA 49.25, declaring violence a leading public health problem, the World Health Assembly called on the World Health Organization to develop a typology of violence that characterized the different types of violence and the links between them. Types of violence. The typology proposed here divides violence into three broad categories according to characteristics of those committing the violent act. 1. Self-directed violence. 2. Interpersonal violence. 3. Collective violence. 1. Self-directed violence. Self-directed violence is subdivided into suicidal behavior and self-abuse. The suicidal behavior includes suicidal thoughts, attempted suicides, also called parasuicide, or deliberate self-injury in some countries, and completed suicides. Self-abuse, in contrast, includes acts such as self-mutilation. Interpersonal violence. Interpersonal violence is divided into family and intimate partner violence, that is, violence between family members and intimate partners, usually taking place in the home. Includes forms of violence such as child abuse, intimate partner violence and abuse of the elderly. Collective violence. Collective violence is subdivided into social, political and economic violence. Unlike the other two broad categories, the subcategories of collective violence suggest possible motives for violence committed by larger groups of individuals or by states. Causes of violence. Violence cannot be attributed to a single factor. Its causes are complex and occur at different levels. The following four-level version of the socio-ecological is often used in the study of violence. Personal, family or friends, community, society. Personal. The first level identifies biological and personal factors that influence how individuals behave and increase their likelihood of becoming a victim or perpetrator of violence. Family or friends. The second level focuses on close relationships, such as those with family and friends. In youth violence, for example, having friends who engage in or encourage violence can increase a young person's risk of being a victim or perpetrator of violence. The third level explores the community context, i.e., schools, workplaces, and neighborhoods. Societal factors that help to create a climate in which violence is encouraged or inhibited. Cycle of violence. This cycle can happen hundreds of times in an abusive relationship. Each stage lasts a different amount of time in a relationship. The total cycle can take anywhere from a few hours to a year or more to complete. Tension building phase. During this phase, the victim often feels as though he is walking on eggshells, being extra careful not to trigger an explosion. The abuser may be moody or irritable. The victim senses a growing tension in the abuser and fears that the abuse could occur at any moment. Explosion phase. This is typically what most people think of when they hear of an abusive relationship. Yelling, hitting, pushing, punching, rape and other forms of emotional, physical or sexual violence can occur during this phase. Honeymoon phase. A cycle can begin or end, often known as the reconciliation phase, with this phase. In order to regain control of the victim after an explosion, the abuser often apologizes and promises that things will be better and that she will change, a tactic that instills hope in the victim. The nature of violent acts can be 1. Physical, 2. Sexual, 3. Psychological, 4. Involving deprivation or neglect. Psychological violence. It involves the regular and deliberate use of a range of words and non-physical or physical actions used with the purpose to manipulate, hurt, weaken or frighten a person mentally and emotionally, and/or distort, confuse or influence a person's thoughts and actions within their everyday lives, changing their sense of self and harming their well-being. Victims of psychological violence make up a disproportionate population of psychiatric patients, with links to suicide ideation and suicide attempts. Children are hidden victims of psychological abuse, with contact often used as a means to continue control. Psychological violence. Increased risk of a lifelong pattern of depression, anxiety, low self-esteem, inappropriate or troubled relationships, and a lack of empathy. Possible delays in developmental progress during childhood. Physical violence and punishment. Associated with behavior disorders, anxiety disorders, depression and substance use. Available evidence indicates an association between physical punishment and increased aggression, reduced empathy and the way in which children absorb and follow moral rules. Sexual violence. A range of outcomes include depression, post-traumatic stress disorder, PTSD, suicide risk, substance use, eating disorders, teenage pregnancy, risky sexual behavior, poorer educational outcomes, and perceptions among victims of their own poorer health. 7. International violence. Armed violence in the community. Research indicates that children exposed to gun violence may experience negative short and long-term psychological effects. Disease outbreak. Some common changes include excessive crying or irritation in younger children, returning to behavior they have outgrown, such as toileting accidents or bedwetting, excessive worry or sadness, irritability and acting out behavior in teens, poor school performance, avoiding activities they used to enjoy, unexplained headaches or body pain, use of alcohol, tobacco or other drugs. Case study. Caucasian female whom you have never met, presents with asthma exacerbation. While doing a lung exam, you notice ecchymosis on her upper arms and back. You order a nebulizer treatment. While she is getting her treatment, you review her chart. Anita is married with 3 young children. She has been seen multiple times in the ER and at the urgent care clinic for various orthopedic complaints including knee pain, ankle sprain, wrist pain, and also for a head injury. Multiple clinicians document that they screened her for IPV, but she denied it. She has also been seen multiple times by one of your partners for chronic abdominal pain. That workup has been negative. Once the nebulizer treatment is over and her breathing is improved, you return to the room and tell Anita that you noticed the bruising on her arms and back. Assessment. She starts to cry and admits that when her husband drinks, he gets angry if she has not cleaned up after the kids or doesn't have dinner ready. Then he hits her. He is always very sorry afterwards and promises it will never happen again. She now thinks that he is not going to stop, because it always happens again. No matter how careful she is and how hard she works, he always finds something that makes him angry. The violence has escalated and is occurring more frequently. He lost his job and is home all the time and drinking much of the time. Intervention. Discussion. Validate her story. Reassure her that it is not her fault. Perform a risk assessment. Help her develop a safety plan. Provide local resources as it is safe for her to take a handout home? If not, problem solve how to get her the information. Engage in motivational interviewing. What does she see as the pros and cons of staying with her husband? Offer referral to behavioral, mental health. Discuss what this will mean for your relationship. Cases. Every 7 minutes, an adolescent somewhere in the world is killed by an act of violence. Data for 24 countries show that sexual violence in childhood ranges from 8% to 31% for girls and from 3% to 17% for boys. Over 1 billion children are victims of violence every year. Approaches. The criminal justice approach sees its main task as enforcing laws that proscribe violence and ensuring that justice is done. The human rights approach. The human rights approach is based on the obligations of states to respect, protect and fulfill human rights and therefore to prevent, eradicate and punish violence. It recognizes violence as a violation of many human rights: the rights to life, liberty, autonomy and security of the person, the rights to equality and non-discrimination, the rights to be free from torture and cruel. Developing life skills in children and adolescents. Developing safe, stable and good relationships between children and their parents and caregivers. Reducing the availability and harmful use of alcohol. Reducing access to guns or harmful items. Other than this, we have to develop our self-control. We have to create our own ethical way and path for peaceful life. No anger, hatred and enmity. Control mind, love and kindness. Practicing yoga, truth and non-violence, prevention of violence. These are some references. Quote, "You deserve to be treated with love and respect and kindness.